afternoon. Today's our topic of discussion is pink of health. So I wish you all a pink of health. So I am Dr. Nafisa Sultana Idris, practicing obstetrician and gynecologist in Aurangabad, that is in Maharashtra. So just now I wish you all a pink of health. What is pink? This color pink of ours says how healthy you are, how much hemoglobin you are carrying, how much amount of oxygen your red blood cells are carrying. So if you are not pink, you are not healthy. That means you are anemic. So why are we giving so much importance to this color pink? There was a survey conducted by National Family Health in 2019. This report says that the prevalence of anemia is increasing. 53% of our population is anemic in reproductive age group. This is the 5th highest globally. So let us see what is anemia. So anemia is a condition in which the number of red blood cells or the hemoglobin concentration within them is lower than the norm. It is estimated that 1/3 of all women of reproductive age group are anemic. Anemia continues to rise among women of childbearing age and growing children. So as per the WHO, hemoglobin more than 11 grams, you are healthy. Anywhere which is less than 11 grams, you are anemic. And the ICMR guideline says that hemoglobin between 8 to 11 grams per deciliter, you are mildly anemic, and hemoglobin 5 to 8 is moderate anemia, and anything less than 5 grams is severe anemia. According to the CDC, in the first and third trimester, hemoglobin less than 13, you are anemic. And in second trimester, less than 10.5 grams, you are anemic. So let us see what are the symptoms of anemia. How do you feel? How should we analyze that something is wrong with you? So the normal work which you are doing routinely, daily, efficiently, now you're not able to do efficiently. You feel tired. You get you loss of interest, and you feel easily fatigued, headaches, your skin looks pale, yellowish, you have yellow tint in your conjunctiva, you loss of sleep, and you have leg cramps, dizziness, your hands are cold. These are the symptoms which indicates that you are anemic. When you feel this, you should go to your doctor. So when your doctor will do a physical examination on you and will run some investigations, and as per the investigation, you have been graded whether you are mildly anemic, moderately, or severe anemia. And sometimes, on clinical examination, that includes the doctors checks for the pallor in the eyelids, tongue, nail beds, palm, etc. There's a certain disorder like pica, where this is an eating disorder in which you feel like licking or eating non-food items like gypsum, chalk, soil, ice, or paper. This is usually prevalent in pregnant ladies who are anemic. So now let us discuss the most common anemia. There are different types of anemia, but I am discussing here especially the most common iron deficiency anemia. Why does this anemia occur? So anemia occurs when we are having our intake of iron is less than our demand. So whenever there is increased iron demand, whenever there is decreased iron intake, and when the absorption of iron, whatever we are taking, in whichever form, if it is not absorbed properly, still you are anemic. And so there are certain disorders where we are losing blood in our body, and that also leads to anemia. So let us see. The increased iron demand are in the infant stages, infants in growing stage, preschool growing children, in growth spurts in adolescence and in pregnancy, especially second and third trimester of pregnancy, where there is increased demand. Poverty, and when there is decreased intakes when you are not taking proper food, when you are not taking balanced food, our food is not balanced, it doesn't have iron, then also you are not taking iron properly. And decrease, there are certain conditions where the iron absorption is decreased, like our diet is only cereal based, which doesn't have balanced one. There also our iron is not absorbed. And certain surgical surgeries which we have undergone, like bariatric surgeries, gastrectomies, duodenal bypass, where the intestine length is decreased, where iron is not absorbed sufficiently. And also the medical disorders, to name some, like irritable bowel disorders, Helicobacter pylori, celiac diseases, and gastritis. In these conditions also, even we are taking proper iron, it is not absorbed. And there are certain conditions where our body is losing blood. Physiological conditions like menstruation, where every child-bearing woman has monthly cycles where we are losing certain amount of blood. So here also our demand for iron increases. And certain medical disorders and certain surgeries, there are loss, we are losing blood, like in ulceration, gastrointestinal ulcerations, and certain medical disorders. And drug induced is some salicylates, non-steroidal, anti-inflammatory, coagulants. There are certain drugs which also, due to which it is a certain amount of bleeding is induced in our body. So now let's see what are the medicines available for the management of. Okay, let us discuss what is the consequences of anemia during pregnancy. Why during pregnancy iron is very important. So maternal anemia contributes to 18% of perinatal mortality and 20% of maternal mortality in South Asian countries, including India. Iron deficiency anemia can have consequences during pregnancy as well as during and after delivery. It can also have impact upon the fetus and a neonate. For a healthy mother and for a healthy baby, iron levels in the body is very important to be in right amount. During pregnancy, iron deficiency anemia can increase the risk of premature labor, premature birth, high blood pressure. It can also give rise to intrauterine death, intrauterine infections in the babies, and sudden bleeding, which may cause sudden IUFD, etc. And during labor, it can prolong the labor because there is no decreased maternal efforts. Mother is tired, she's not able to bear down, which has consequence on the baby like fetal distress and all those things related to the baby. And also there can be placental related issues. And after delivery, during, if the mother is anemic, the uterus does not contract well, giving rise to atonic PPH, and there can be tears, and unnecessarily there can be lots of problems, giving rise to excessive blood loss. There can be infection, and later on there can be failure to produce sufficient milk, and it may also give rise to depression. Later on the mother can develop depression also. Anemia in mother can impact the baby as well. The baby could have a low birth weight, or have increased risk of infection, and anemia. Baby can also develop anemia and has abnormal cognitive development. The IQ levels of the baby can be low. Okay. So what is the management of anemia? Pregnancy is a demanding physiological state. Usually the pregnant mother has a different diet which can meet the increasing demand of pregnancy and the growing fetus. But in India, it is observed that the diet of a woman from the low socio-economic group are essentially similar during during pre-pregnant, pregnant, and lactating periods. Consequently, there is a widespread maternal malnutrition leading to high prevalence of low birth weight infants and very high maternal mortality. Additional foods are required for weight gain in pregnancy and weight gain of fetus. The mother as well as the growing fetus need iron to meet the increasing high demand of RBC formation. A simple medicine, folic acid, taken throughout the pregnancy reduces the risk of congenital malformation and increases the absorption of iron. And hence it helps in increasing the birth weight of infant. The mother as well as the growing fetus need iron to meet the high demand of RBC formation. Okay. And the pregnant and also the lactating woman should eat a wide variety of food to make sure that her own nutritional need as well as those of her growing fetus are met. There is no need to modify your dietary pattern, but you should see that certain things are included and you should see on the quantity and the frequency of the usage of the different food should be increased. Minerals and vitamins requirement are met by consuming a variety of seasonal vegetables and particularly green leafy vegetables, fresh foods, milk, and poultry items. Thus, if we include this thing in our routine diet, also is sufficient. Though it is possible to meet the requirement for the most of the nutrients through a balanced diet, but pregnant and the lactating women are advised to take a daily supplement of iron, folic acid, and vitamin to remain healthy throughout the pregnancy. So a diet plan for iron deficiency anemia needs to include a healthy balance of iron-rich food such as meat, poultry, seafood, iron-rich vegetables, nuts, seeds, beans, and seasonal vegetables. It's also crucial to include foods that can improve the body's absorption of the iron and avoid food that may interfere with this process. For example, vitamin C. Vitamin C is very important for the absorption of iron. So a glass of lemon juice, orange juice, citrus fruits included daily in our routine is very helpful. So what are the medicines available for the treatment of anemia? So anemia can be treated in 3 ways. It can be treated orally with the oral iron supplements, parenteral iron, and IV injections depending upon the demand and the gradings of anemia. If you are mildly anemic, daily supplement of 100 milligrams per day in the form of tablets is sufficient. This needs to be taken for 4 to 6 weeks to increase your iron levels. But certain women doesn't tolerate iron orally, or in spite of taking iron treatment orally, your hemoglobin is not rising. In that condition, we can shift to the parenteral iron. Parenteral ions are of 3 generations. First generation, second generation, and third generation. First generation is iron sucrose, which needs to be taken in 7 to 9 doses to increase 3 to 4 grams of hemoglobin. Then comes the second generation. This is ferric carboxy maltose, which is sufficient usually in 1 or 2 doses to increase 3 to 4 grams of hemoglobin. And the third generation is iron isomaltoside, 1000 or more than depending upon your hemoglobin levels, and that is sufficient in 1 shot or 2 shots. So now they ask, why should one take iron tablets during pregnancy? Again, anemia during pregnancy has been associated with the poor maternal and birth outcomes, including premature, low birth weight, maternal, perinatal, and neonatal mortality. So our aim is to have a healthy mother and a healthy baby. Just by improving your levels of hemoglobin during the pregnancy, you can avoid lots of complication and the mortality. So we are aiming and wishing for a healthy baby and a healthy mother. So the extra demand of iron, especially during the pregnancy, is often unmet by routine diet. So regular supplementations of iron is recommended throughout the pregnancy. And we have seen that prevalence of postpartum iron deficiency iron is also very high in India. Untreated iron deficiency anemia during the postpartum period is a cause of maternal morbidities such as tiredness, lethargy, dizziness, headache, lactation failure, and postpartum depression. Once the mother who is having a small baby, her work increases. She has to take care of herself and also the neonate. But if she is anemic, she is not able to do her routine work. This may give her leads to postpartum depression. National Iron Plus Initiative recommends iron and folic acid supplementation every day for at least 100 days starting after the first trimester, that is 14 to 16 weeks of gestational for all anemic, non-anemic mother till the 100 days of postpartum parturition. All that period of high demand is met with the iron supplementation. Some national bodies also recommend daily iron with folic acid for all non-anemic women in postpartum period for 6 months. Because here the lactation also needs iron, extra high demand in your body of iron. So generally anemia in postpartum represents a dire need for iron supplementation. In such anemic patient, parental iron supplementation can also be considered in treating anemia. During pregnancy, during delivery, we lose sufficient amount of blood. So if the mother is anemic, then she is also anemic during her postpartum period. And in our routine practice, what we have seen is the mother attend the antenatal clinic only during her pregnancy and maybe 1 or 2 visits after delivery. But they usually don't come after delivery. So the extra efforts are made to treat postpartum anemia by giving the parental iron. So there is a way to take iron to get the maximum absorption of it. So always avoid taking iron supplements along with caffeine such as coffee, tea, milk products, and antacids and high fiber diet. These all will interfere in the absorption of iron. So always take your iron supplements with a glass of orange juice, lemon juice, which has sufficient vitamin C, which helps in the optimum absorption of iron. You can also take at the bedtime with a small snacks so that your intestines are not upset. Your stomach is not upset rather. So remember to take iron supplement daily. So keep it handy where you can remember and take it daily. You can keep them in the purse, keep in the car, keep in the bedside so that you don't miss them or skip the dose. So usually iron and iron supplements are very safe, but sometimes it can have some non-specific side effects like nausea, vomiting, constipation, diarrhea, and black stools. But black stools is not a side effect, it is normal. But anyway, when you face this problem, consult your doctor and your doctor will do counseling accordingly. Some common side effects associated with iron supplements include constipation, dark stools, stomach upset like pain, bloating, diarrhea, nausea, vomiting. Sometimes they face metallic taste, etc. Inform your doctor and the doctor will counsel accordingly and change your dosage if needed. Always consult a doctor before taking any medication. Remember that you and your baby needs to be healthy. Take your iron supplement and be in pink of health. Thank you.